Hello, my name is John Kell, or Reggie, and me and Diana will be doing video number 1, and I'll be doing 1 through 2, and she'll be doing 3 and 4. So to start off, number 1 is asking, explain the error or errors noted throughout the video. So to start off, the nurse tells a UAP or a CNA to tell another LPN to give a patient a drug. This is a very bad case of delegation because a UAP cannot be telling another LPN to give a patient a drug. If the nurse knows what to give a patient, then they should be the one actively doing the seeking to give this patient a drug. Also, the LPN tells the UAP to administer a med to a patient. Whether it be an over-the-counter drug or a prescription, it should never be given by a CNA to a patient. That's not in their scope of practice, so that's a very, very bad case of delegation also. And whenever the CNA walked into the patient's room, there were no identifiers. There were no, because the patient didn't give their full name and date of birth. There wasn't any checking of the MR number of their chart, so that's another example of an error. And the CNA didn't assess for any allergies because this is a very big issue. The whole issue of the video in general was the allergy to the Benadryl, and because it was given to her, and this is what happened with this sentinel event. Also, there wasn't a check of the dose of the medication. We don't know if this patient has to be given a smaller dose or a larger dose, so that's another issue. And the UAP didn't also know if it was Benadryl or not. Just because the LPN said, oh, here you go, this is Benadryl, we don't know what medication is being given, which in the first place should never have been done. So overall, there was just a whole bunch of poor delegation and poor communication being done in this video. And number 2 is asking, indicate how utilizing the 6 rights for medication administration could have been created a positive outcome. So first and foremost, the nurse should have been the one actively seeking to give this patient their medication. So number 1, they should have walked into the patient's room. The nurse should have walked in and verified the patient with their full name and date of birth from their wristband compared to the chart with their MR number, critical elements, of course, and to see if it's the right drug. If this patient is getting the right drug, if they're allergic to it, we need to know what kind of drug is being given to them and why we were given it. Also, the right dose. If it's the right medication, we need to know how much is being given to the patient. Whether the patient is maternal age or pediatric, we need to know how much of the drug is being given and if it's going to be therapeutic or if it's going to be an overdose or toxic for the patient. Also, the right route. We need to know how the medication is going to be given. Either it be orally, it be given some other route. We need to know what route is being given and if it's safe for the patient. And the right time. We don't want to be giving medication that's too early in the care plan of the patient, or if it's too late. We need to know and be wary of what medication is being given and at what time. And the biggest one I feel like that wasn't done was the right documentation. We were stressed a lot during last semester that if it's not documented, it never happens. So to cover your own assets, you have to always document what you do or it never happened. And so for my source from Angela Hansen and Lisa Haddad about the 6 rights of medication, they say that patient safety and quality of care are essential components of nursing practice and priorities that demand consideration to enable the delivery of high quality, patient-centered care and overall well-being. So in order to do all of this for a patient, we need to be wary and vigilant on the 6 rights of medication to know that we are giving the right care, the right treatment, and that no sentinel events happen, because the patient always comes first with their safety. And of course, you want to cover your own butt and know that you're doing things right. So this is a long video. Okay, Diana's turn. Bye-bye.
So in this event, unfortunately the patient dies, and it could have been easily preventable if the correct steps were done. You know, like they said, like the patient was allergic to Benadryl. Even if the nurse or the LPN looked at their chart to begin with, they could have easily seen like this section on the side that they're allergic to Benadryl. But unfortunately, And since these series of events were not taken in place, the nurse or the health could have easily, she could have gotten fired, easily lose her job, or got charged or something because the patient did die. And that's another thing. The family, their loved ones are probably devastated from something that they were not expecting, to lose a family member that they were expecting for them to come back home. And even so, in this case, the organization, when things like this happen, they do a thing called root cause analysis, also known as RCA, where they have kind of like the risk management team, which includes the nurse manager as well as the risk managers, to kind of find out what happened from before into what led to that death. And that's according to the book Pharmacology from McQuiston, chapter 9, page 73. And there's a few instances where I saw a medication error because I work at the pharmacy, and it's a very high traffic area where we're constantly with patients and never stops. It's never like a break time. And so there have been instances where the technicians left a medication on the side, and then they forgot about it. They just left it there out in the open. They didn't put it back where it's supposed to be with the other meds. And so when they went to help another patient, they would accidentally give the medication that was left nowhere, kind of just right there. They would give that medication to a completely different person. And it has been a few times throughout the years that I've been working there, and that unfortunately nobody has had any severe reaction that they took it. Nobody's taken it before, but that would have been a near miss.